Thanks so much for having me today to this gathering. I'm really pleased to talk to you a little bit about how charities might support that collaboration and integrated care. And actually there is quite a lot of nice links across to what we've already heard in terms of the things that Francis and Sarah have talked about. Before I sort of launch in, could you just raise your hand if you work in and around paediatric healthcare, just to get a sense of whether there are a few people in the room? Okay, so the balance is definitely not in that space today. But I think it's, there are lessons from what we do that are easily transferable, but also people that you work with are parents, carers, grandparents, aunts and uncles, and the whole issue around children's health is obviously something that is on people's minds and people are dealing with day in, day out. We all know that we're bombarded with messages around ill health, how we prevent ill health and injury. I think the thing that's much less on people's mind, adults, thinking about their own health, but also that of their families, is what can happen when you're suddenly faced with a hospital stay in the family and the immediate practicalities and issues that throws up. These can have hugely significant impacts on people's lives and their ability to actually deal with their healthcare journey, particularly if it's a child and particularly if it's unexpected. So it really won't surprise you to know that if you suddenly end up in hospital because your child needs hospital treatment, those like real practical life issues about how can you be by your child's bedside when you're juggling everything else in your life, what to do with other children in the family, the siblings, where you're all going to sleep, are hugely urgent at that moment in time. And then over a longer time frame, things like how do you wash your clothes, how are you going to juggle work-life pressures, all suddenly come to the fore. This puts people under absolutely enormous pressure. So that's what I'm going to talk a little bit about today. And that's obviously exacerbated by the geography of specialist paediatric healthcare. And I'm sure it's exactly the same in lots of other domains in the NHS as well. So this is just an example of where the specialist liver treatment transplant units are around the country, but also the yellow triangles are where the craniofacial specialist units are. And you can see that there's an awful lot of travel going on if you need that healthcare provided to you or your family over time. And the families that we work with, we find that they travel on average 70 miles for that specialist treatment, but 1 in 10 of them are actually travelling more than 100 miles away. So the way that the geography of specialist treatment has developed over time means that there's an awful lot of people suddenly finding that they're far away from home when they're accessing the treatment they need from the NHS. When I chat to people about what I do, they always find it sort of amazing that issue around family accommodation and supporting those very practical elements around having healthcare is not something that's really embedded into the thinking about NHS provision. And when you're in hospital, as lots of you will know, the sort of things that you could be offered very hugely from a chair. This is a slightly jazzed up one with a few cushions, but a chair, possibly a pull-down bed, maybe a bunk room to sleep in so that you could be near your child. But we also know that loads of people, sadly, are still sleeping in their cars, if you can believe that, because they just can't face the long commute home and they just don't want to leave the hospital, and that's the only option that they have been given. There are obviously hotels, hugely expensive, out of reach for lots of people, often not actually that near the hospital where their child is, and also really a lonely and isolating experience if that's where you end up staying, because you need to be near a loved one who is in hospital. And all of these options obviously don't help with other children in a family, so people who do have more than one child are faced with having to juggle that. So, not surprising to know that this has an absolutely huge impact on people emotionally, financially, practically. They're under huge pressure, and that sort of stress of having a sick or injured child or family member is really compounded by all those other pressures that people are dealing with. So that means in terms of a child's healthcare journey, it's really hard to be present, it's hard to be involved in those discussions with clinicians, it's hard to be on the ball when you're making decisions, if you're commuting, if you're exhausted. But also it's really difficult for the medical team because they don't have the interactions with the family that they would want. We've talked to people through the Association of Chief Children's Nurses about the impact that the lack of family accommodation has on them, their medical teams, their ability to do their jobs properly. And unsurprisingly, the sorts of things that they've told us are about the difficulty of working with families when the mental well-being of parents is under such huge strain. The difficulty for the whole family if parents and carers can't actually spend time with their child, and that ability to just be involved in a child's healthcare journey is obviously hugely under stress. This obviously is just a massive issue when we're thinking about integrated care. How do we really understand what families are going through? We've talked about the housing issue, the nutrition elements of that, but just understanding what pressures are families under and how best to respond is really difficult when parents themselves aren't able to show up and be part of those conversations. So as a charity, it won't surprise you to know that we're really laser focused on this, and we're all about trying to support families with that real sense of resilience, being able to be there with their child, the time that they can actually spend in the hospital wards, but also the just general physical and mental well-being of parents, carers and the wider family unit. So this is where our houses come in. House is a bit of a misnomer in this context because some of them are huge. They range from about 9 bedrooms to over 80 bedrooms. And what we offer is lovely bedrooms. Our standard offer is a 2-bedroom room like this. It could be either set up as a double or a twin, but they both have trundles under them, so you could sleep up to 4 people. We've got opportunities to actually extend that out into an interconnecting room for larger families or longer stays, so that families can stay together, be together. There's a landline straight to the children's hospital ward in all of our bedrooms, so all those worries about network coverage and do I have enough data on my phone don't exist. Got lovely communal spaces. There are pictures here of our lovely welcoming reception areas, kitchens to cook in, gardens, laundries to do washing, Wi-Fi. We've got trained staff to welcome people. But we've also got a really well-proven model now of in-house hospital houses, where basically you're in the hospital, you're in a clinical setting, you go through double doors, and you're suddenly in a homely, welcoming environment where people can get that respite from having long hospital stays in what can be, really anxiety-inducing times. So this is just a flavour of what we can offer. Because of this infrastructure, the families that stay with us get the chance to have a good night's sleep. We've got lovely partnership with a bed company that makes sure we have excellent beds. Be part of a community. So we've got staff in our houses that understand what families are going through, the pressure that they're under, and they can offer a compassionate and caring ear. But you're also surrounded by families going through other things. You would not get that if you're in a hotel, obviously. We really support the maintenance of healthy routines, so the ability to cook nutritious food, the ability to do laundry in the way that you'd want to, just to try and keep that sense of normality when life really is turned upside down. Families get privacy. They've got their own ensuite bathroom. There are other quiet spaces that they can use, and they can also work or study from this home so that they can protect their livelihoods. While you're in the house with us, there's also a whole range of other support people can access. Food, grab and go is what we call it, where you can just take healthy snacks when you go to see your kid in hospital. Lots of activities and celebrations and things to try and make sure that people still have those special moments with each other. But we also collaborate with lots of other organisations and charities to really tailor care that we can give, whether it's for people who are going through oncology treatment, whether it's for people who are in the neonatal system, so that you're getting that community support from other organisations who are well placed to do that. So much testimony. I'm not going to bombard you with videos, there's hundreds on our website, but we just work day in, day out with families who could not be more grateful for their ability, apart from anything, just to keep their family together. So this quote is from a mum who stayed in our house in Brighton, but you can see at the end here, she's just so grateful that she can have her other child with her when she's caring for the kid in hospital. That is just something that isn't a core part of the NHS offer, but it is so vitally important to thousands of families around the country. In terms of where we operate and what we do, we've got 14 houses at the moment around the country. We offer about 530 rooms, so that's about 200,000 rooms per night per year that we can offer families around the UK. In the main, we work with hospitals where there are multiple specialisms for paediatric care, so places like Alderhay, Birmingham, Women's and Children's Hospital, the Evelina here in London. We do have some smaller houses, like I said at the beginning, but that tends to be where there's a specific need. So, for example, Moorfields Eye Hospital, we work with St George's in Tooting because they've got a neonatal unit there that desperately need cover. But we have a huge range of houses, and I said is the model that I'm most excited about in terms of our future is where we can actually be part of new hospital build programmes and provide all of this essential care within a hospital setting. What the sort of financial prioritisation means at the moment, we don't tend to be in hospitals where there's just one specialist service, which means I'm aware that where there's a CAM service, where there's a NICU, there are often really underserved in terms of how to keep families together and supporting one another. Just in terms of a bit of the scale of what we do, so last year we accommodated 8,500 families almost. People tend to be with us just over 2 weeks, but some people are with us for years. That won't surprise you, I'm sure. And that has huge benefits for them, obviously, in terms of the practical nature, the emotional nature, but there's also environmental benefits of this. We're saving millions of miles of commuting every year, so that's something that we're hugely proud of. The cost of that is about £15 million a year for the charity. So I'm going back to this. So the cost of that is about £15 million a year for the charity. On average, just paying for our room per night, just the service delivery of that, not running the charity, it's about £35 a night. So it's hugely good value. And just thinking about some of the things that Francis was saying about innovation that could be scaled up, this is a brilliant service. It's a proven, desperately needed one, and something that we could and we would love to scale up more. The next slide, sorry, went on to it a bit quickly, is because I'm sure people have sat here slightly wondering, it's a very odd name for a charity, what's that all about? So just really quickly on that. So the name of the charity comes from the fact that Macdonald was one of the charity's founding corporate partners. They don't run the charity, we're independent, but what they do is they allow us to fundraise from their crew, from their franchisee operators, and also importantly from their customers. So a lot of our income, around half of it, comes from that broader Macdonald's operation. In the UK, we're celebrating our 35th birthday this year, but the charity itself is 50 years old. It was the brainchild of a wonderful woman called Audrey Evans, who was a paediatric oncologist in the States, and the first Ronald Macdonald House was actually opened in Philadelphia in 1974. There is a film about to come out starring Natalie Dormer about the life and work of Dr. Audrey Evans. So it's a really nice celebration of her legacy, particularly in relation to these amazing houses. They're now operating in 60 countries, 62 countries actually around the world. So it's grown into an enormous global operation. We've grown hugely over the last 35 years, partly in response to the geography of paediatric healthcare, and this just shows how the number of rooms has grown hugely. I think the demand is absolutely here to stay. We know that a large amount of people staying with us are because their kids are getting urgent care, critical care, going through the neonatal system. I don't really see that changing. However, we do know that as the pattern of healthcare changes in some of the ambulatory sensitive cases that you mentioned before, that actually the houses can provide really brilliant ways for families to step down out of hospital, transition back home. So there's lots of ways that we could work together in partnership with the NHS to support families on their healthcare journey. There's huge unmet demand there at the moment. I know lots of hospitals who have multiple specialist services who just can't provide this type of support for their families. And sadly, this whole area of family accommodation is so often an afterthought in terms of the NHS, and I'd be absolutely amazed if there's any mention of that at the end of the week when the report comes out. It really isn't embedded enough in people's thinking about how to provide healthcare to children and families. So we know that we need to provide much deeper support to the families staying with us. It's not just about expanding the numbers, it's also about how we support families staying with us. They're under huge pressure at the moment. So 3 of the key themes that come out when we ask them are around their financial pressures, mental health pressures, but also the need to work from home. We know it's expensive to have an ill child, a child in hospital, but a recent survey that we did about how those cost of living pressures were playing out really were shocking. A quarter of our families having to skip meals, 40% of our families having to ask friends and families to lend them money. The financial pressures really are acute. They're desperate for mental health support, and that's an area where we want to work much more in collaboration with others to respond to that. When we speak to our medical colleagues in partner hospitals, they tell us that's something they're most worried about, how we can really protect the mental health and well-being of parents when they're going through such a stressful time. And also that whole issue about working from home and how we support people to maintain their livelihoods. We get amazing feedback from families staying with us. Unsurprisingly, they're so grateful for the support, but also from the medical teams who work with us. This lovely quote from the Chief Children's Nurse at Alderhay really sums it up. And just at the bottom here, I guess, is really the heart of the rationale for the charity, just that ability to allow parents to be involved in medical discussions and input into medical decisions. You need to be there, you need to be on site to do that, you need to be well rested, you need to have your wits about you, and the medical teams really do see that our accommodation brings that. So just to finish, it's lovely to be here. I really hope I get the chance to chat to some of you over coffee. I hope what I've brought to this day is that sense of family accommodation and caring about the whole family unit shouldn't be a luxury, it shouldn't be an afterthought. It really is an essential part of how we care for the next generation and how we look after parents who have got ill children. As a charity, we want to continue building that coalition of support for this area. We want to collaborate. And if anyone would like to talk more about how we can do that, please do come and grab me. My email address is there, but I'd love to hear from you. And yeah, look forward to chatting over the course of the day. Thank you.